Prophet Muhammad, peace be upon him, taught his companions never to hit the face or head of children or even adults. Abusive head trauma can not only be caused by hitting the child on the head, but also by shaking. Today there is a common problem amongst the world known as abusive head trauma, AHT, that can be caused by direct blows to the head, dropping or throwing the child or shaking the child. Head trauma is the leading cause of death in child abuse cases in the United States alone. Because the anatomy of infants puts them at a particular risk from injury from this particular kind of action, the majority of victims are infants younger than 1 year of age. Abusive head trauma can happen in children up to the age of 5 years old, and the average age of victim is 3 to 8 months. However, the highest rate of cases amongst infants are just at 6 to 8 weeks old, which is when babies tend to cry the most. Anyone has the potential to shake a baby if he or she isn't able to handle stressful situations well, has poor impulse control, or has a tendency towards aggressive behavior. Substance abuse often plays a role in abusive head trauma. Babies are born with heads that are at an advanced stages of development. The brain reaches half of its adult size by 9 months and nearly 3/4 by 2 years of age, so the heads of babies are bigger in proportion to the rest of the body. Now let's take a closer look at some of the neck muscles. As you can see, the neck muscles of the babies are smaller and weaker compared to those of adults and older kids. Here's where the danger is. As you get older, your neck muscles become bigger and stronger and give support to your head. But babies and kids to the ages of around 5 years of age have weak neck muscles due to them being not fully developed, so this provides little support for their heads. When someone forcefully shakes a baby, the child's head rotates uncontrollably. This is because infants' neck muscles aren't well developed and provide little support for the heads. This violent movement pitches the infant's brain back and forth within the skull, sometimes rupturing blood vessels and nerves through the brain and tearing the brain tissue. The brain may strike the inside of the skull, causing bruising and bleeding to the brain. After the shaking, swelling in the brain can cause enormous pressure within the skull, compressing blood vessels and increasing overall injury to the brain's delicate structure. Normal interaction with a child, like gently bouncing the baby on a knee, will not cause these injuries, but it's important to never shake a baby under any circumstance. What are the effects? Abusive head trauma, AHT, often causes irreversible damage, and about 1 out of every 4 cases results in the child's death. Children who survive may have partial or total blindness, hearing loss, seizures, developmental delays, impaired intellect, speech and learning difficulties, problems with memory and attention, severe mental retardation, cerebral palsy. Even in milder cases in which babies look normal immediately after the shaking, they may develop 1 or more of these conditions. Sometimes the first signs of these problems isn't noticed until the child enters the school system and exhibits behavioural problems or even learning difficulties, but by that time it's more difficult to link these problems to the shaking incident from several years before. Signs and symptoms in less severe cases. A child who has been shaken may experience lethargy, irritability, vomiting, poor sucking and swallowing, decreased appetite, lack of smiling or vocalizing, rigidity, seizures, difficulty in breathing, blue color due to the lack of oxygen, altered consciousness, unequal pupil size, an inability to lift the head, an inability to focus the eyes or track movement. Child's development and education. What makes abusive head trauma so devastating is that it often involves a total brain injury. For example, a child whose vision is severely impaired won't be able to learn through observation, which decreases the child's overall ability to learn. The development of language, vision, balance and motor coordination, all of which occur to a varying degree after birth, are particularly likely to be affected in any child who has AHT. Such impairment can require intensive physical and occupational therapy to help the child acquire skills that would have developed normally had the brain injury not occurred. Abusive head trauma is 100% preventable. A key aspect of prevention is increasing awareness of the potential dangers of shaking. Finding ways to alleviate the parent or caregiver's stress at a critical moment when a baby is crying can significantly reduce the risk to a child. Some hospital-based programs have helped new parents identify and prevent shaking injuries and understand how to respond when infants cry. If a baby in your care won't stop crying, you can try the following recommended methods that often help. Shushing. By using white noise. A white noise machine creates these natural sounds of nature effects. Sucking. Letting the baby breastfeed or bottle feed, or giving a baby a pacifier or finger to suck on. Swaddling. Wrapping the baby in a blanket to help him or her feel more secure. Hips and knees should be slightly bent and turned out. Swinging gently, rocking in a chair, using an infant swing, or taking a car ride to help duplicate the constant motion the baby felt in the womb. Make sure the baby's basic needs are met. For example, he or she isn't hungry or doesn't need to be changed. Check for signs of illness like fever or swollen gums. Gently rock or walk with the baby. Talking to the baby. baby. Take the baby for a ride in a stroller or strapped into a child safety seat in a car. Hold the baby close to your body and breathe calmly and slowly. Give the baby a warm bath. Pat or rub the baby's back. Call a friend or relative for support or to take care of the baby while you are taking a break. Call your doctor if nothing seems to be helping your infant, in case there is a medical reason for the fussiness. To prevent potential abusive head trauma, AHT, parents and caregivers of infants need to learn how to respond to their own stress. It is important to tell anyone caring for the baby to never shake him or her. Talk about the dangers of shaking and how it can be prevented.